Hey, it's your girl Kimmy B from the new hits 97.3, a patient of the amazing Dr. Wigoda, and of course a radio personality here in South Florida. Now, about 3 years ago, I came to get a painless breast augmentation with Dr. Wigoda, and he was so amazing that, I had to tell everyone in South Florida about him. And of course, in talking about it on the radio, I get a lot of questions. People will see me out at different events, and they'll ask me, Kim, how did you choose Dr. Wigoda? Or how did you decide if you wanted silicone or saline? So I figured I would put together a list of questions. I would come see Dr. Wigoda, and I would have him give you the answers to the most common questions I get asked regarding plastic surgery and plastic surgeons in South Florida. So are you ready, Doc?
I'm ready.
All right. So the number one question is definitely, how do you choose a plastic surgeon? And basically, what should any plastic surgery patients look out for in a plastic surgeon?
Okay, so the most important decision a patient makes is who their plastic surgeon is. Because the plastic surgeon is going to guide them as to what type of implant, what size implant, where to put the implant, all those sorts of things. So patients really need to do their research. Go on Google, go on the internet, read about your surgeon, go to their website, and then go to review sites to see what their reviews are. You can have a great website, but if you have a lot of bad reviews, obviously that's a red flag. And that's really the most important thing. So the most important decision the patient's going to make is who their plastic surgeon is. The plastic surgeon is going to guide you as to what type of implant, what size implant, how they're going to do the surgery. So that's really the most important thing. And for patients, they really need to do their research. Go online, go to Google, look at the doctor's website, look at the before and after pictures, look at review sites, because you can have a great website and have bad reviews or vice versa. Once you go see the doctor, you want to make sure you're comfortable with the doctor. Does the doctor spend time with you? Do they answer your questions? Are they rushing in and out of the room? Are you spending most of the time with the salesperson trying to sell you on the surgery? Or is the doctor sitting there answering your questions, making sure you're comfortable, you've chosen the right size, et cetera, et cetera. So I think those are the basics. Basically, make sure you do your research. Don't go just based on a friend referring you or any other reason.
They're going to do the surgery. I know that's something that unless you know people who have had breast augmentations, I came for painless breast implants, there's definitely different ways to go about doing implants, as in through the nipple, underneath the breast, underneath the muscle. That's what you're talking about, right?
Correct. So there's different incision options. The most common incision is under the breast. It's called the inframammary fold. Probably second most common is around the areola. Less common is the axilla or the armpit, and rarely done is through the belly button. Belly button is just for saline implants, and very few doctors do that. There's a lot of benefits to doing it in the fold. You go underneath the breast, you don't have to cut through the breast tissue. And that's my preference as well. But if patients want to go through the areola, that's fine. There's something called a capsular contracture, which is a hardening of the breast, and there's a little bit higher risk of that happening if you go through the areola than if you go through the fold. Now, one difference with the way I do it, as far as making the pocket for the implant, the way I do it is a lot less traumatic, and that's the reason it's painless. It doesn't have to do with the size of the implant, or I use a funnel to put the implant in. It doesn't have anything to do with that. It's just how you make the space for the implant. Patients generally don't lose any blood when I do the surgery, so they have no swelling afterwards, they have no bruising, and all of that reduces the pain. So patients do feel pressure afterwards because you're putting an implant under the muscle, and the skin has to stretch, the muscle has to stretch. But the way I do it, generally there's no pain.
The reason why I asked that question is because you clearly would like to go to a doctor who will give you all of your options. Dr. Wigoda definitely took the time to explain all of those options to me when I came in for my consultation, the pros and the cons, the benefits to the way that he does the procedure. So again, like Dr. Wigoda said, ask the questions, and it really is about your level of comfort with the doctor that you choose. You should never feel like you were rushed. You should never feel like you have unanswered questions. It is a surgical procedure, and it's your body. So definitely go to somebody who takes the time to make you feel comfortable. That's just my recommendation and suggestion. Now, my second question is, what does board certified mean?
Okay, so board certification is very important. You want to go to a plastic surgeon who's board certified in plastic surgery. Basically any specialty, whether it's internal medicine or gynecology, has a board certification. So board certification basically means you went through an accredited residency, then you passed boards, whether they're written boards or oral boards. In plastic surgery, it's both. You can be board certified in gynecology and do plastic surgery. So you want to make sure they're board certified in plastic surgery.
Got you. Now, I know one of the questions that I had when I came to you was, what's the difference between a silicone implant and a saline implant? Because I was always under the impression that saline was better.
Correct. A lot of patients have that impression. What I can tell you is today, probably 90% of patients get silicone. Silicone feels more natural, it usually looks more natural, and patients prefer that. There's also less chance of getting ripples. So I actually brought some implants here. This is a saline implant, and if you look at it closely, you can see these little wrinkles. And sometimes you can see that if you don't have a lot of breast tissue. You oftentimes see it on the outer part of the breast. This is a silicone implant, and if you feel them, this feels a lot softer, this is a lot harder. So this in the breast will feel harder, this will feel softer. This can look a little more fake depending on the patient's anatomy. This can look a little bit more natural. Other differences with saline, if at some point it breaks, it will deflate. So you know that it broke. With a silicone implant, if you get a tear in it, nothing happens usually. Silicone, it's now called a cohesive gel, so all the silicone is stuck together. The silicone just doesn't ooze out. It doesn't spread into your breast, it doesn't spread into your body. It's not dangerous, you don't get sick, you don't have pain, and basically you won't even know that it ruptured. And when we use the word ruptured, we're not talking about an implant exploding, it's just a tear. The only way to see that tear is usually an MRI. So the FDA does recommend periodic MRIs. Realistically, women don't really get the MRIs. And the reality is most implants are going to last a long time, maybe 20 or 30 years or even longer. The chance of an implant rupturing at 10 years is probably less than 5%, so about 1 in 20 will last less than 10 years. So, the odds are pretty good it's going to last a long time. And like I said, most patients prefer silicone.
So, wait a minute, because most of us are under the impression that you have to have your implants replaced every 10 years, because there's a lot of doctors out there that tell you come in and have them changed out after 10 years.
Right, that's a total myth. If your implants are fine and you have no issues whatsoever and it's 30 or 40 years later, you don't have to change it. You only change them if there's any problem, if you want to change the size, or if you get a capsular contracture, or if they break. But if you're happy with them at 10 years, you do nothing. If you're happy with them at 20 years, you do nothing.
See, you gotta love a doctor who's not about the buck. Because it sounds to me like you have people trying to basically make extra money by telling patients you need to come in after 10 years and have them replaced for no reason whatsoever.
That's just a fallacy.
And then obviously there's also different profiles to implants.
Correct. So there's low profile, there's moderate profile, there's a moderate plus profile, there's a high profile. And patients come in all confused and think they want a certain profile. What a lot of patients think, for example, with a high profile, patients say they want the fullness at the top. And they think that means I need a high profile. The high profile has nothing to do with that. So I brought a couple implants just to show. Both of these implants are about the same diameter, meaning they're the same size, side to side. This one I believe is a 450 cc. This is a 590 cc. This is a moderate plus profile. You can see how it's a little bit flat, whereas this one projects more. And that's really what the profile is. The profile is how much it projects.
Gotcha.
And really what determines which profile you get is how big you want to be and how wide your chest is. Because if you put an implant like this on your chest, you don't want it sticking out the side. And if you want to be bigger, then you need a higher profile that doesn't stick out from the side. So usually the surgeon will really determine what profile you need. It's not something a patient needs to worry about, and then I'll explain it to them. The higher profiles potentially could look a little less natural, but at the end of the day, it doesn't really make that much difference as far as what's natural and what's not natural. It's really just what fits your chest wall and what size you want to go.
Well, thank you. Well, that's a big deal. And of course, unfortunately, a lot of us, we have something in our minds that we think, and I know even for myself when I came in, I was under the impression, that I only wanted to be, I think, a full C. And you and I went back and forth for a while about size. So as far as choosing the size, or how do you know what's the right size, how do you help your patients through that decision-making process?
Okay, so first I actually ask them what size you think you want to be. Then I go through pictures with them and I'll show them what I think is an actual B or C or D cup. Because what they think is a C cup or D cup may not be. Then we'll try on sizers. So this is a sizer that I use. We have different sizers, and I'll just literally put it on top of their breast, look in the mirror and say, that's good, that's too small, that's too big. And so based on pictures, based on sizers, and based on their body frame, as far as what I'll recommend, that's how we ultimately determine the size.
Got you. And then of course, as far as anesthesia goes, I mean, there are some people who that's part of the fearful process of going in for a surgical procedure. So what kind of anesthesia do you use, and how do you kind of get them through that whole kind of aspect of any type of plastic surgery process?
So before the day of the surgery, the patient gets lab work done, an electrocardiogram, regardless of how old they are. I get it on everybody. I just want to make sure that everything looks good. So first we make sure that their blood work and EKG are good. We obviously take a history and know what their medical history is. Most patients we see are healthy, but some patients have medical problems. It could be diabetes, it could be some other autoimmune disease, it could be anything. So we make sure we look at that as well. And then I always do breast implant surgery under general anesthesia. General anesthesia means an anesthesiologist puts you to sleep, so you're completely asleep. It's not IV sedation or oral sedation that some centers will do. In this center, you're completely asleep, so you feel nothing. The only thing you'll feel is when they start your IV, and then after that, you feel nothing. So you have the surgery, you wake up, and you're done. Other centers, to save some money, might try to do it under local anesthesia or some IV sedation. I don't recommend that. You're going to be very uncomfortable, and general anesthesia, I think is really the way to go.
Well, when I finished my painless breast implant procedure, I woke up and I felt literally amazing. There are videos on drwigoda.com of me immediately after surgery, and I know I was under the impression that, I had a very good friend of mine who had a breast augmentation. She was completely out of commission for like 2 days. She could barely move when she was leaving, her surgery center. So for you, when you say painless breast implants, what is your process and what makes it so different than others, and why don't all doctors do it?
So that's a very common question I get. If you go to my website or to my other website, painlessbreastimplants.com, there's over 100 video testimonials of patients. I interview them the day after the surgery for the most part, and they all say they feel great, they have no pain. Some of them drove there themselves. In some cases, patients who have lifts with implants, same thing, they have no pain. And even though patients see all those videos, they still don't believe they're not going to have pain. So I usually call my patients the night of the surgery, and they are in disbelief about how good they feel. And really, it all comes down to technique. It's not that complicated a technique, but most surgeons just don't know how to do it. And again, it has to do with how I make the pocket for the implant, that it's a lot less trauma to the tissues. A lot of surgeons are really rough. They tear the muscle, there's bleeding. All that causes pain, swelling, and that's just not the case the way I do it.
Now, of course, I'm sure the next question for a lot of people is, well, like, you have this special procedure, it's got to cost more, right? So as far as the cost of painless breast implants or plastic surgery in general, right? Why are some places more than others? And if somebody is cheaper, does it make them dangerous? How do we look at the price point?
So, there's a range of prices, as with anything in life. You can go to the cheap places, you go to the most luxurious places. To a large extent, you kind of get what you pay for. I would say my prices are pretty average. They're not more expensive because it's painless, but we get a lot more patients because it's painless. When you go to the cheaper places, they do have to cut corners because you just can't provide the most safe experience at those low prices. And the cutting corners might be having surgeons that aren't that qualified, or surgeons who have had a lot of problems in the past and they lost their practice and they have to work at these centers. They might cheat a little bit on the anesthesia. There's all kinds of ways you can cut corners, but at the end of the day, it has to do with the patient's safety and the ultimate result. Unfortunately, there's been a few patient deaths. Not really even a few. Every few months seems like there's a
Yeah.
patient death at one of these discount centers. And the bottom line is they're rushing through these surgeries because they have to do so many because they're cheaper. And at the end, it's just a less safe process. And if a patient, wants to save a few $100s and risk their life and potentially not even have a good result, then those are the kind of centers you would go to. It's worth it to spend, literally, it could be a difference of a couple $100s to have a good result and a good experience if you come to a place like this.
My last question is going to be, obviously, breast augmentation is hands down one of the most popular plastic surgery procedures in the United States, but you're pretty cutting edge. What are some of the other procedures that you're seeing become more popular now?
So I would say in the last couple of years, there's two procedures that they're not as popular as breast implant surgery, but they are becoming more popular. One of them is the Brazilian butt lift, which is basically a liposuction procedure. You lipo the belly, the back, the thighs, wherever there's excess fat, and then you take that fat, you process it, and you transfer it into the butt. And actually the contours that we can get are really quite amazing.
So it's kind of like a 2-for-1?
It's a 2-for-1.
Like you're getting rid of the fat in the areas you don't want it, and you're sticking it in a place where you do want it.
Exactly. The other thing that is becoming more popular is actually vaginal rejuvenation. Women are tending to have less hair down there and less coverage, and things are more exposed, and so they want things to look good, whereas before it wasn't as much of an issue. So I would say those two procedures, what we call the BBL or Brazilian butt lift, and then vaginal rejuvenation are becoming more popular because our techniques are better and because of just social reasons, for the vaginal rejuvenation.
And of course you do both of those here.
We do both of them here.
Well, Dr. Wigoda, I thank you for taking the time. And of course, don't forget, if you have more questions, drwigoda.com. Super accessible. You guys are on Facebook. You're also on Twitter and on Instagram. At Dr. Wigoda? Is it?
Yes.
And do you have a phone number, or would you just, I think if you just go to drwigoda.com, you can submit any questions and set up consultations, correct?
Right. On the websites, you can do a virtual consult, or you can just ask questions, and I respond to all of those myself. And then patients will come in. We actually have patients coming from all over the world, literally, and they start off with a virtual consult.
Well, that's because you're the best at what you do, Doc.
Thank you.